Welcome, Dr. Dubin.
My name is Justin Dubin. I'm a urologist. I was actually born in Wayne, New Jersey, North Jersey. And then I did my undergraduate school at Johns Hopkins University in Baltimore, where I majored in biology. I worked at Cornell in the Upper East Side of Manhattan for 2 years. And at that point, I didn't understand what urology is. I had no idea. I actually thought I was going to be like the team doctor for the New York Giants was kind of my goal back then. And I happened to get a job at Cornell in urology. I was like, this is kind of cool. I didn't know what this was. And I ended up going to medical school at Rutgers Robert Wood Johnson back in New Jersey. And I was deciding between orthopedics and urology. And I ended up choosing urology. Did my residency here at University of Miami in urology. And then I wanted to specialize in men's health. So I went to Northwestern, where I did my fellowship in men's health, which is male infertility, sexual medicine, testosterone replacement therapy. And what I really liked about urology and specifically men's health is when we think about medicine, most of the time we're thinking about people telling us like, don't die, you're going to do this, we got to prevent you from dying. And it's not the conversation about living and life. And as a men's health practitioner, I get to focus on quality of life more than quantity of life. But if I can prove to you that I can improve your quality of life by doing certain things, those things will also actually improve the quantity of life that you have. So I have this really unique opportunity to show people that how you take care of yourself and the lifestyle that you live really will have impact overall. The thing that we like to say in our field is sexual health is health, because we're going to talk about a couple things today that, can impact your sexual health. And we're talking about erections, testosterone, fertility. So a lot of problems in sexual health, if you have erection issues, if you have fertility issues, if you have testosterone issues, those are warning signs of other health things going on, or they are warning signs of something coming down the pipeline with your health. So if you want good sex, if you want to have a great sex life, you better start taking care of yourself. And for guys who don't want to talk about their health, if I'm able to convince them to, come in and talk about their erections and improve their health, then maybe I can convince them to do these other aspects. So it's a really fun challenge because people don't want to talk about these things.
Yeah, I was going to say, I feel like from listening to some of your episodes, a lot of what you talk about is destigmatizing just men's health in general. And the men, just have this lack of wanting to seek help and think that, I can do it on my own, or I'm okay, until they push things off to where it's no longer preventative care, right? And it's an actual issue that needs to be solved immediately, potentially. So I love what you're doing and bringing light to what can be a really difficult topic, I think, to speak about. And you said sexual health is health, but did you mean sexual health is wealth?
Both. Actually, okay. Sexual health is health. But it is wealth. But
okay.
But yeah, to your point, the studies show that less than 50% of men under the age of 40 go see a doctor once a year. So
wow.
Guys are not doing that. And however, if they can't get it up, they want to see me tomorrow, right? Like that's the one thing. And if I can show you that, you can do these certain things before, you may not have to come see me so soon because you're going to have that problem.
Let's talk about that a little bit more, because I have a best friend and he works in investment banking in New York City. He has no time, right? Like he is slaving his life away.
Right.
And I keep saying to him, you need to go to the doctor. You haven't been to a primary care physician in years. And I feel like a lot of what you hear about these guys that are working these long hours is like their health deteriorates. They're sitting all day. They're eating food out all the time. He's never cooking for himself, right? Like he's losing some of his hair because he's stressed and he's not eating properly. So I'm sure there's things that he could do by just going to the doctor, getting even just blood work done to help. So can we talk a little bit more about that? And like, what is the first step to getting ahead of some of these issues that you're even seeing?
Yeah, so I think when we're talking about lifestyle things, a lot of the things that younger people ask me about, it's often erections, it's testosterone. Fertility, as you get into your 30s, starts being part of the conversation. But all of this kind of goes around lifestyle. And when I talk about your health, there's kind of, I would say, 5 things that we can do to improve our overall wellness. And this goes for women too. One is you need to have good sleep health. Sleep is so important. We know, especially for testosterone, it's highest in the morning and it goes down during the day naturally. You get your sleep, your sleep restores your testosterone levels. So you need to sleep at least 7 to 8 hours. We know that people who are doing shift work, who have long hours, they're at higher risk for having low testosterone. We know that people who are overweight, who have things like sleep apnea, where they're snoring, have low testosterone. So sleep is so important, and there's so much data out there about how important sleep is. 2 is you need to be active, okay? When we're talking about activity, we have, cardio and we have weightlifting. The data shows for men, and actually for people in general, resistance training, weightlifting is actually better for improving your testosterone, improving your bone health, your muscle density. So, but obviously getting moving in any capacity is really important. 3 is your diet. You are what you eat kind of situation. The best studied diet is really the Mediterranean diet. And we have a saying also, what's good for your heart is good for your parts, good for your heart, good for your penis kind of thing. So you do really want to eat healthy. Decreasing processed foods is really big. Vegetables, fruits, fish, the proteins that, organic things are really important. 4 is more of a newer concept, is reducing endocrine disrupting chemical and microplastic exposure. Over the last 5-10 years, there's been some really interesting data, suggesting that microplastics, endocrine disrupting chemicals can be found in testicles and also in the penis, in female genitalia and organs. So, things that I've done over the last few years is I've stopped using plastic cups. I'm using only glass now. I'm changing all my containers in my house to glass containers. I'm not storing anything in plastic. I'm not microwaving plastic anymore. I'm changing my shampoos. I'm changing my deodorants. I'm changing my dishwasher detergent. These things are not necessarily easy. I'm not saying that you have to do all of these things, but these are things that we're starting to understand, especially if you have kids. You probably don't want to get them exposed to these kinds of things. Or the 5th thing is actually something I don't know if I can help everyone with: decreasing stress. Yeah. Life is hard, but stress, high cortisol levels can also decrease your testosterones, compromise your sleep, and cause all these other issues. So these are the general things that we can do to improve our overall wellness.
Yeah, and just thinking about, again, kind of bringing it back to my own personal connection to all of this and going back to my brother, for someone that can't get 7 hours or 8 hours of sleep a night, who is very stressed, can only control what he's eating to an extent, right? He can only really control a couple out of the 5 things that you mentioned. Are there any, at that young age, in your mid-20s, you would say, that really starts to affect you later on in life? And is there anything you can do to, I guess, out of those 5 things, what are the crucial things that you could do if you're really not able to do a lot of them?
That's a great question. And someone who has gone through residency and probably had zero success in all of them. I was going to say,
you went through it for 10 years.
I probably was 0 for 5 for several years there.
Right.
But I think that the key that I've always told people when they're coming up or trying to do something stressful in their lives, or they're going through a new patch, what my mentor early on once said to me is, you have to develop habits that defeat your stress, right? And those habits, for some people, we've all seen it. Some people choose alcohol. Some people choose, eating shit, eating poorly. But you have to find some kind of habit that is healthy that you can go do in times of stress. Even when I was, at my worst, I had to get to the gym at least 4 times a week. It was just something I could do. Now, I don't expect everyone to do everything all the time, but you have to make a little bit of room for a little bit of something. I think diet at the end of the day is probably the most important thing, but exercising and just getting out. If you're in an office all day, maybe the answer is getting a walking, a flat platform that you can use and walk 2 miles per hour while you're doing work. Yeah. Or, just take a step out and go for a 10-minute walk, get some air. Meditation is always great to decrease stress. And there's so many apps that you only need about 10 minutes. So finding what gives you pleasure in these small moments throughout your day or throughout your week. I don't think it's possible to necessarily do all these things, right? But if you can find a little bit of time to prioritize maybe one or two of those things, I think it's going to go a long way in the long run.
Right. And I think the message too behind it all, I mean, correct me if I'm wrong, is like, you can always revert back, right? You can always, like, in your 30s, right now you have more time now that you're a practicing physician, and you've been able to like adopt these like healthy lifestyle practices. But what you don't want to come to is like, you know, you're grinding through your 20s and you end up having this like major health issue arise. So have you seen any situations where patients have come in, like maybe they're late 20s and had similar working conditions like you know, in fellowship and residency, or like an investment banker, and how that's really impacted their health?
All the time. Literally, I saw like 3 people today who, you know, they come in and but here's the key, right? They're coming in for help. A lot of people in the situations that you're discussing don't. But I saw at least 3 patients today came in, they were overweight, they had diabetes, but they wanted to do something about it. And I can tell you that I've been following these guys for several years. They've lost 50, 70, 80 pounds moving, going to the other doctors, getting their sugars under control, getting their pressure under control. If they have low testosterone, we're treating that. So, you know, all of these things, you can only do so much by yourself. And I think that the key has to be here of this whole interview should be communication. When we're talking about our health, we need to communicate it with ourselves. We have to be honest with ourselves. We also need to communicate it with our doctors, which means going to find a doctor if you don't have one so they can help you. And when it comes to relationships and dating and sex, we need to be honest and communicate with our partners as well. So communication, which is probably the hardest thing for guys to do, is the key to living a better, happier life.
So going back to just like your younger patients, like let's say mid-20s to mid-30s, like what are the most common issues, concerns that they have when they come in to see you?
So I think the 3 things that I see in the younger guys, they're concerned about testosterone levels. They ask a lot of questions about pornography, and then they ask a lot about their erections and erectile dysfunction. I don't know if there's one you want to start with, or...
Yeah, let's start with the pornography one, because I know we had talked outside of this, and you said that you were one of the first doctors to do research on female porn stars. Is that
and
right?
Male porn stars.
Oh, and male porn stars. Okay, very
So
interesting.
yeah, a while back when I was at Miami, we saw a lot of young guys, and they were asking about pornography. They were coming in with concerns of erectile dysfunction, and you know, we can get deep into the conversation about what causes erectile dysfunction maybe later. But a lot of these guys would sometimes come in and they'd be like, "Hey man, I was watching this guy. He was going like 25 minutes, 30 minutes. I can't do that." Fun fact: penetrative intercourse on average lasts about 3 to 7 minutes. So, you know, that is the average. So if you're going longer, great. If you're going around there, fine. That's just penetrative. There's a lot of other kinds of things you should be doing with a partner before penetrating or after penetrating. But we saw it enough, and we were in Miami. We're no better place than that. So we decided to do a study where we looked at the sexual health of male porn stars and female porn stars. So long story, it was a long way, fun story in itself of how we were able to do this study. But we ended up surveying a significant amount of male porn stars and female porn stars. And what we found out was, and you can't even make this number up, it was too good to be true, 69% of male porn stars were using medications during their porn shots or their entertainment. They were using Viagra, Cialis, things like that. Of the men, about 60% of them were using something both at home, personally, and at work. And about 40% of men actually met the category to be diagnosed with erectile dysfunction. So the key there was, you know, you can't be comparing yourself to other people, right? One, they're professionals. They're incredible athletes. They know what they're doing. 2, they're corking the bat, which is totally fine. That's what they're there to do. They're there to perform. So I use that as a tool and a guide for anything in life. You know, you can't compare yourselves to a lot of the things out there because it's not fair to you, and it puts unwanted and unneeded pressure on yourself. For women, we found out that female sexual dysfunction, you know, I always say men, we get it up or we don't. We're very simple, right? Women, when it comes to sexual health, are a lot more complicated. Female sexual dysfunction is a much more complicated diagnosis, but it's incredibly common. About 40% of women above the age of 18 have female sexual dysfunction, which is grossly under discussed. But that can include things like lack of desire, pain with intercourse, inability to achieve orgasm, to name a few things. And so we surveyed women, and we found that only 24% of these women actually had met criteria to be considered to have female sexual dysfunction, which is way lower than the 40% that we see in the general population. And looking at that kind of makes sense, because the average age of the female was about 34, which means they've probably been in the industry for a while. And if it really hurt and it wasn't pleasurable, you probably weren't going to stay in it.
Right.
And that's how I would explain that.
And what about the other areas beyond pornography and what people are asking you about?
So erectile dysfunction, I think, is the most common. And erectile dysfunction is the most common sexual dysfunction that men face. It's incredibly common. The data shows now about 30% of men in their 30s, 40% in their 40s, 50% in their 50s, 60% in their 60s, 70% in their 70s, you get the picture, have erectile dysfunction as we get older. And you've seen it all over podcasts. You've seen it online. All these ads now for Blue Chew, or I'm not going to say the companies, for all these companies that are advertising direct-to-consumer care for erectile dysfunction. And there's been a lot of concerns where are people using them more? How many young men are using these things? And there wasn't any data on it until about a year and a half ago, when we surveyed men under the age of 40, and we asked them, we did a survey to see if they met criteria, if they had erectile dysfunction, and we asked them if they had taken it in the past, how they got it, and what made them determine how they got it.
Yeah, so my question too is, and this is like another potentially myth that I wanted to debunk with you later on, but it comes up now because I feel like women don't really know what ED really is, or how to diagnose it maybe, or know if their boyfriend or partner has ED, and maybe he just thinks, oh, he's drunk, he has whiskey dick.
This is great.
So how do you know the difference between whiskey dick? Is that a myth, number one? And number two, whiskey dick versus ED? So
this is a great question. And technically, anytime you are unable to maintain or get an erection, you have erectile dysfunction. It can be a one-off, but if you consistently have it, then you meet the criteria of having erectile dysfunction. I will tell you with almost 100% certainty, every single man on earth has not been able to get it up at one point in their lives. If they tell you they haven't, they're lying, okay? So that's number one. This idea of whiskey dick is, I think, real. So what happens when you have alcohol is it can compromise blood flow to your penis, and it can also compromise your nerves, right? You're a little bit numb. It messes with your sympathetics and your parasympathetics, which are, crucial for you to get an erection and ejaculate. And just to give you a background on erections, since you're asking, so in order to get a good erection, you need 5 things. 1, you need good blood flow to your penis. What can compromise that? Vaping, we now know, smoking, heart disease, diabetes, things like that. 2, bad nerves. Sometimes for older men, if they have prostate problems like prostatectomy, they have their prostate taken out. Or if you have diabetes, a lot of younger men are getting diabetes at a younger age, and the first thing to go is sometimes your penis, actually. Number 3 is you need good testosterone levels, and we talked a little bit about that. Number 4 is going to sound funny, but you need to be aroused, right? Now, I ask a lot of my patients, I'm like, they seem healthy, everything's normal. I go, well, how's everything at home?
I was going to say, does it come down to the attraction to your partner?
Correct. It can, but it's not necessarily attraction in that moment. It's in general. It could be attraction in that moment or at that time frame. And a lot of times they're like, listen, things have been great, but now we're trying for a kid. I'm really stressed out. I don't really enjoy the process of having sex anymore. Or we were in a big fight for the last week because of something that was going on, and I'm just not aroused, right? So that is a big factor. And the last thing is you need to be in a good state of mind. Stress, anxiety, the medications, unfortunately, that can treat stress, anxiety, depression, can also compromise that. And so these are all things that can factor in. So that's one reason why some young men, although they're healthy, can actually have erectile dysfunction. And that study that we looked at, over 50% of men under the age of 40, which is a higher number than we thought, actually met criteria for having erectile dysfunction. And 40% of them had actually used a product like Viagra or Cialis in the past.
Yeah, speaking of like all of these, drugs, and even talking just about like a guy being like, I'm really stressed at home and I don't really enjoy having sex, like that's not something you often hear from a man's perspective. So curious what you would say about just horny levels between like men and women. Is it true that men are typically hornier than women?
So I don't know how to quantify that. I don't know if there's an answer to that. I don't know if there's a study out there, but I will tell you that horniness and our libido, which is our sex drive, can vary. It can vary through the day. It can vary through the year. It can vary situationally, right? But I don't think that there's this myth that like guys are ready to go all the time. They're horny all the time. I don't think that's true. And I'm sure some women are way hornier than a lot of men. And a lot of men are less horny than a lot of women. So I think it's all individualized. And I think a lot of that can, be impacted by your health. I think what is important though for both men and women is that, at least in the case of men, decrease in your sex drive and your libido is the most sensitive thing and is the biggest indicator of a low testosterone. So out of all the signs and symptoms, decreased energy, decreased mood, weight gain, erectile dysfunction, decrease in your libido, a consistent decrease in your libido is a sign, the most sensitive sign that you may have low testosterone. So if you have been a horny guy for your whole life and then all of a sudden it's been 3 months and you just don't have a desire, go talk to your doctor about it. There may be something going on.
What is a healthy amount of time to be jerking off per week?
This is a great question because I think a lot of women are very interested in this because I see this on socials. Like my boyfriend jerks off like a million times. Like he doesn't not attracted to me or whatever. And it's like, oh, he masturbated like twice this week. Like what's going on? So first off, I don't think there's an unhealthy or defined unhealthy amount to masturbate or not masturbate. Some people just don't want to masturbate. They don't enjoy it. And some people like to masturbate every day. But I will tell you, there is a threshold where it probably becomes unhealthy, where it's distracting you from other things, right? If you're only masturbating and you're not with your partner and you don't want to engage in sexual activity with your partner, or you're not going out and you're masturbating all day, or you're not doing work or going out with friends, then it's a problem. There was an interesting study, though, that did show that ejaculating more than 21 times a month decreases your risk of prostate cancer. Now, am I saying that you should go ejaculate? That's not necessarily masturbating. Am I saying you should go ejaculate 21 times a month and you're never going to get prostate cancer? Absolutely not. It's just a factoid, some additional thing that you can consider. If you're ejaculating 21 times a month, God bless, man. Enjoy yourself. If you're not, don't worry.
Don't worry about it.
But the answer
don't they say, I think even for women as well, they say it does boost your immunity.
Yeah, so there's a lot of benefits to sexual activity. And we do know that couples that engage in sexual activity, I believe it's at least I'm going to say once a month as they get older, in their older age, they live longer. I'll just say in general, couples who are more sexually active throughout their lifespan, they do live longer and they are happier. And that kind of makes sense, right? Yeah. Because after all the things we talked about, you have to be pretty healthy in order to be sexually active as you go through life. Mm-hmm. And if I can convince anyone the importance of health, it's like, do you like to have sex? Do you want to continue having sex? You better take care of yourself now.
So I want to talk about the young man's disease, I think they call it, right? Oh,
what's the young man's disease?
No. Oh, like under 30, it's more common to get testicular cancer.
Oh.
Isn't that the young man's disease?
It's what
do they call it?
They call it that.
Oh, I thought you
said
said
a young man's cancer.
Young man's cancer. Maybe that's what I was. Sorry. Yeah, I mean, I think it's surprising. And I think it's great now, finally, like in the last few years, I feel like men have been more open about going through, being diagnosed with testicular cancer. I've personally gone on dates with at least a handful of men that have had it under the age of 30, which is pretty crazy. And they've, gotten their testicle removed and have a fake testicle now, which is pretty crazy that you can do that, like an implant.
Do them all the time.
Oh, you do that? You do the procedure? Yeah. Oh, very cool. Yeah. So I do want to hear a little bit more about that. It's essentially like a boob job for your testicle, right?
I've never looked at it by that way, but yeah, I guess it is. So,
I know, that's how I was thinking about it in my head.
That's actually really good. I guess it is, right? So it's so testicle cancer is the most common cancer in men between the ages of 15 to 35. So it is a young man's cancer. 15 to 30, 18 to 35, you can say. But the problem with testicular cancer is it's in your testicle. So guys really often delay their care to see anyone about it. And I can tell you from personal experience, I don't have testicular cancer, but I have a couple friends who did growing up. And, the story is typically the same from the ones that I still see and I treat today is, I felt it about 6 months ago, didn't do anything, wanted to see what happened. And then eventually they come in 6-8 months later and we diagnose them. Now, what is testicular cancer? Is it painful? How does it present? And actually it's a painless lump on your testicle. So what you can do, it's very easy. When you go in the shower as a guy, we all know that our testicles drop. It's easy to feel them. And you can just massage your testicle, go over each one and just make sure you don't have lumps, bumps, or any abnormalities. And if you do, just go talk to your doctor. We get an ultrasound. It's that simple. And God forbid you do have an issue. The procedure itself is quite straightforward. We make an incision above your belly. We actually don't go through your scrotum. And we remove the testicle. Takes about an hour. And then we can put a prosthetic in. And the prosthetic is made of silicone. We fill it up with some normal saline, which is like water. And I size it to your other one. So,
you never know.
You never know. You would never know.
You would never know.
They feel the same. I'm going like this on both of them at the same time, making sure that the feel is the same, the size is the same. And most people, you would never even know.
So it's best to obviously catch it early because obviously this is one of the most curable cancers, correct?
Correct. It is an incredibly curable disease. Even if, God forbid, it did spread to your spread outside of your testicle, it is still a very curable disease. But this is an important thing. Any young man who has any kind of cancer, as a fertility specialist, I want to highlight the idea of banking sperm and preserving your fertility. Anyone with cancer, especially those who are treated for cancer in terms of getting chemotherapy, radiation, you are at risk for being infertile after, truthfully. And I know when you're young, you really are thinking that you're invincible. And the diagnosis of cancer in any young person, this stands for women too, it can be daunting and you're just thinking about surviving. But we have amazing medical advances over the years, right? We can treat your cancer. And what I tell my patients is cancer sucks. Going through cancer sucks. Life after cancer should not have to suck. And that includes family planning. And whether it's you're a female and you want to, go store your eggs, preserve your eggs, or a man who wants to go sperm bank, these things last in perpetuity because you're going to be around. We just want to make sure that you can have that family that you want.
So is it best to preserve I guess let's just say the cancer is curable, you've caught it early, right? And you're just removing the cancerous part of the testicle. They're going through surgery and that's all they need. They don't need radiation or anything post-op. Is that when you would
we don't know.
The sperm?
We don't know until we take everything out sometimes. So I always recommend anyone before they get any procedure, any intervention, if we're concerned it's cancer, I would recommend for men banking sperm. It's easy. It's relatively cheap. I think for a year, it's about $700.
So you would do that pre-surgery?
I would do it pre-surgery.
I
try to do it pre-surgery.
I wasn't sure when that would occur.
I try to, and that's a conversation I have with all of my patients. And everyone in my hospital, they know that if someone's getting a procedure and they're a young person, they know they can reach out to me and I can talk to that patient before whatever that procedure is, and we can talk about banking.
And in terms of chemotherapy, is that only if the cancer has spread elsewhere?
Yeah. Typically, especially for testicular cancer, if it's contained, we're typically just monitoring at that point.
Okay, so it's uncommon, or I guess how common is it that men would need chemo after?
I don't have any.
There's no
numbers.
Okay,
I'm sure there is. I just don't know.
Okay, I was just curious.
The answer is
you got
just
a lot of numbers up there, so I'm like, let me just ask him.
Ask. I'm happy to tell you if I do or don't. Yeah.
So I want to talk a little bit more about some TikTok trends that I've seen, and let's debunk these together and see if they're true or false. This is quite an interesting term. I don't know where this came from, but I got on the male side of TikTok,
It's a dark,
prepping for
sad
our interview.
Place. It's
And
a crazy
now
place.
wish I was off of it, but we're not off of it yet. So there's this term called jelqing. Have you heard of jelqing?
Absolutely, I've heard of it. Yeah.
So patients come in sometimes and ask you about jelqing?
Yeah, so I'm going to give a little bit of background before we talk about jelqing, because I think it's really important what you're talking about now, and I thank you for highlighting this. So I did a study 3 years ago because I was on TikTok and I was trying to understand the men's health space, the young men's health space, like what guys were interested in learning about and what kind of information is out there. And I started coming across all this horrible stuff, truly like insane stuff. And we did a study where we surveyed, I reviewed 6 different topics. We looked at erectile dysfunction, something called Peyronie's disease, vasectomy, male infertility, semen retention, and I can't remember the last one, but and I went through the top 50 videos for each one of these things. I analyzed them, who was giving the information, was it accurate? I kind of lost my mind because it's, as you've experienced, it's a very crazy place. But what we found out was all of the information, and we're talking about billions and billions of views, is inaccurate. Like most of it is completely inaccurate, and less than 10% of it was given by doctors. And that makes sense, right? So really important as we go through these topics like jelqing is, when we talked about the stigma online, the stigma of men's health. And one topic that I didn't bring up is in that survey of erectile dysfunction in young men, I asked why they decided to go the route that they did for their medications. And they picked privacy as number one, right? Privacy over cost and privacy over convenience. So they're willing to pay more so no one knows about their problem, and they're willing to be more inconvenienced as long as no one knows, right? So that is the direct highlight of the stigma in men's health. So where do they go? They
TikTok.
go to TikTok. And now we know that all this information is horrendous. No providers on there. It's mostly businesses or just random 18-year-old dudes giving health advice, which is kind of crazy to me.
You're right.
Right? So basically, back to your idea of jelqing. Jelqing is this idea that you can make your penis bigger by just yanking it. And that sounds funny, but that's literally what it is. You just grab your penis and you just continuously yank it.
And that is absolutely false, correct?
Of course. And not only is it bad, it can actually shrink your penis.
Oh my gosh.
Because it can cause something cause Peyronie's disease, where it can cause scarring of your penis, so it can shrink. It can cause erectile dysfunction. You can fracture your penis. So yeah, it's actually the opposite of what it's trying to do. I definitely don't recommend doing that. I don't recommend listening to little TikTokers online. When you go online, and this is really important, and you're getting health information, and I like to call this the IKEA. You're going through, your building furniture phase right now as you move to Miami, which is a great apartment. Congratulations. But I call this the IKEA problem. Okay, so guys, I'm a little bit older, so like before MapQuest and like all like Google Maps and Apple Maps was around, I call it the directions problem. But when you go to the store and you go to IKEA, guys, we are not following the directions on how to build this thing. We're going to just look at it. We're going to try and figure it out ourselves. It's going to take 2 times longer than before. And then when we finish it, it's going to look almost complete. But the chair is going to be like a little bit wobbly. We're going to go back, look at the directions, and then do it in about half the time, and it's going to be correct. Why? Because we don't want to do anything. We want to fix it ourselves. We want to do it ourselves. And that's what guys are doing with their health. They want the privacy. So they're going online. They're going to TikTok. They're going to Instagram. They're getting horrible information like you're getting, like you saw, about jelqing. At best, they're delaying their care that they need, and they're maybe spending some money on some product or supplement. At worst, they're actually harming their health. So the important thing here is when you're online and you're looking for healthcare and for health information, there's actually good information out there. But you have to ask yourself questions. 1, what am I looking up? 2, why am I looking this up? What is my goal? Am I trying to learn an intervention? Am I trying to just learn about this disease state? Am I trying to prevent something? Am I trying to buy something? 3, who is providing me with this information? What's their background? Are they just some random influencer? Are they some 18-year-old who's claiming that if you joke long enough, your penis is going to get 2 times bigger? And then 3, like, are they pushing me a product? Are they trying to sell me something? Because like a lot of these things are like, what's their goal out of this? Is it education? Is it to pitch you a product? Is it to sell you a medication? Because all of these things are online and we have so much access to it. All we can do is really educate ourselves on the right way to navigate this. And at the end of the day, before you do any of this stuff like joking, go talk to your doctor about it, because no doctor is going to be like, joke away, buddy, joke away.
Well, that's why it's so important that you have your own podcast now and you're actually speaking out on these topics, and people should certainly do their research before they find out who to listen to online. So hopefully more people are a little bit smarter than the normal TikToker, but unfortunately there's a lot of misinformation out there. But it's great that you're debunking a lot of this with your own podcast. And I also think a lot of the time people think it's always the woman's fault, right? Like, oh, the woman's the one with the fertility issue. Oh, like she has, whatever it may be, or she's leading to his ED. And that may not really be the case. It's because guys just don't know how to ask for help and don't know that it could be their issue.
This is one of the most important things. I think this is probably the most important thing. If guys can walk away and girls can walk away from what you just said, is amazing, because there is an unfair stigma and burden on the female partner when it comes to sex, when it comes to fertility. When we think about fertility, most of the time it's like, oh, we're having issues. She's going to go to the doctor, get worked up, do the IVF, blah, 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 blah. The data shows that couples who struggle with fertility, 30% of the time it's strictly a male factor, and there's a male factor involved 50% of the time. It takes 2 to tango. So if you as a female and a male are struggling as a couple with fertility, and that's defined by, unfortunately, female age less than 35 is 1 year. 1 year, and if you're above 35, 6 months. If you're unable to achieve a pregnancy while you're trying, you both should go to a doctor. You go to the reproductive endocrinologist. I go to a male fertility urologist. So that's part 1. When it brings to sex, this is such an important point. This idea of men and women are to blame, or women are to blame for erectile dysfunction. This came up so much during the last few years when I was a resident. I had a lot of people asking me this, that we actually did a survey on this. We surveyed over 13,000 women from 130 different countries. And we asked them if they've ever been blamed for a loss of erection. Well, 1, did they ever have a partner who lost their erection during sex? 2, were they ever blamed for it? 3, how did it make them feel? And what were the results of that relationship? And what we found out was that about 80% of women had experienced their partner losing an erection during their lifetime. This is women from the ages of 18 to 85. And so most women are going to experience a partner who are going to lose their erection at some point. What was more concerning was 1 out of 7 women had been blamed by their partner for erectile dysfunction. Now, that resulted in the end of the sexual event, no shit,
no more.
Increased stress and anxiety by the partner. And 3, the partner was much more likely to end the relationship at some point because of the erectile dysfunction. So once again, communication. I promise you, the female, you are not the cause. Listen, if you guys are having an argument, sure, you're both the cause, right? But I can very rarely, if you're like assaulting someone, maybe they'll lose their ED or lack of communication. But in general, all of the things we've discussed for erectile dysfunction, I didn't mention that the woman's fault is one of them, right? So I think that what you're saying is so important. Just as a counter to that, I posted my study on Reddit because I wanted to see what the results were and how people thought about the results. I did have a feedback from a lot of men from an aspect that I didn't even consider, was that how the female partner reacts to the loss of erection is also just as important in that situation, right? And obviously making fun of someone for losing their erection or, making a big deal out of it, can also impact the man and their future interactions in that situation. So once again, it is still a two-way street. How we react, and sex is uncomfortable. It's embarrassing for many people. It's fun. It's sloppy. It's everything. It's funny. It's sexy, but sometimes it's not sexy. And I think that if we all embrace the awkwardness and the fun of that, I think we can all be a little bit better in the bedroom.
Yeah. That's great advice. So a couple last questions for you, Justin. This is a podcast about inspiring Jewish people in my life. I know you are a proud Jew.
Yes.
I know when we had chatted offline just about some of the work that you do, you have patients sometimes that come in that had maybe recently converted to Judaism.
Yes.
So obviously we all know as Jews, your baby's born, week 2 or maybe week 1 of their birth, you have a bris, right? And that involves a circumcision. What does circumcision look like post
as an adult?
Conversion?
Yeah. So I have done circumcisions for adults who have converted to Judaism. It's actually pretty cool.
And is it safe?
Oh, it's very, very safe. I do a lot of circumcisions for people who aren't Jewish. They just, as adults, are having issues with their foreskin. To be honest, it can be a cleanliness issue. It can be a painful thing that some people deal with. So I do a lot of circumcisions, and it's totally safe. The recovery period, it takes me about an hour to do. You're sleeping completely, and you just can't have sex for about 2 weeks. And then you're kind of good. There's some sutures around your penis. I tell my patients it looks like a lion's head mane of stitches around your penis. And, but yeah, no, I have done conversion circumcisions, which are really fun. There was a point where I was considering being a moil. Maybe some point down the line, we were thinking about, shout out to Daniel Furlong, my co-resident who grew up in Miami, who's also Jewish. During residency, we were thinking about becoming Just the Tip Moils. As the company. We didn't end up following through. That's a great name. I think there's something still there.
I think that's in your future.
It might be in my future.
I think that might be retirement for you.
It could be fun. It could be
volunteering.
Fun. But no, I think Judaism is such an important part, and I'm so honored to be part of those conversions. And it's funny because we talk about all the things that's going on in the world, and we find ourselves defending ourselves and really talking about the wonderful things of Judaism, but you don't see anyone we're not trying to convert people, right? We're going out there and we're just showing love towards everyone and trying to just make sure that we have a good, safe place to be and a safe community. And obviously we're always welcoming to new people who want to be part of that community. And I think, that's one thing about being Jewish that I've always loved is that, we're a minority. There was such a small amount of us in the world that when you meet someone else who's Jewish, you just automatically have this comfort, this communication that is beyond words. There's this cultural understanding. There's this sense of community that I've lived a lot of places and with a lot of different people in a lot of different places. And it's something that everywhere I go, I can make that connection with a Jewish person better than most. But and so I'm so honored to be here in South Florida, helping out obviously the Jewish community, but any man who wants to come in and really talk about their health. But it's important that especially us Jews that we talk about our health, and if we're having fertility issues, we're having health issues, we got to talk about it, because I can't help you, no doctor can help you unless you make the decision to talk with us.
Totally. Well, thank you for all that you're doing, Justin. It's been great chatting with you. Dr. Dubin.
Thank you so much. This was really great.
Thanks for your time, and we'll chat soon.
Absolutely.